Case number 2. A 2-year-old girl presents with a generalized seizure lasting 8 minutes. She has a temperature of 38.5 C and was recently diagnosed with influenza. Her brother had febrile seizures at a similar age. Considering the epidemiology and risk factors for febrile seizures, which of the following factors is least associated with her condition? A. Age of the child. B. Recent diagnosis of influenza. C. Family history of febrile seizures. D. Gender of the child. Correct answer D. Febrile seizures commonly occur in children between 6 months and 5 years of age, making the child's age 2 years a significant risk factor. Viral infections, such as influenza, are known to be associated with febrile seizures, making this a relevant risk factor in this case. A family history of febrile seizures increases the likelihood of a child experiencing them, which is applicable in this scenario. While there is a slight male predominance in febrile seizures, the gender of the child is the least influential factor among the options provided, as febrile seizures can occur in both genders.